Welcome, everybody, to my next episode of the Psych Crusader. And I'm your host, The Expendable. If you don't watch my Expendable show and you're into politics, check it out. I tend to try to cover things a little bit more in depth than the average bear because there's generally more of the story. But so if you do like my show, please hit the like and subscribe button and ding the bell. That way, anytime I do something ridiculous, you will find out about it first. So I'm going to take the time I got my author copy of my newest book, The Swiss Effect, written by me. And so I'm excited about that. Now, once I get my big box of books, I'm going to be running around trying to sell them all over the place. So, which I like that part of it, because I get to meet people and mingle and talk and hear different views of things. But that's besides the point. Today we're here to talk about schizophrenia. So schizophrenia is a very, very tricky situation. And if any of you that watch the show know anybody who suffers, and schizophrenia truly is, it's a suffering, but not a suffering at the same time. So if you know people who have schizophrenia or schizophrenic tendencies, this is going to be something you guys are going to want to hear, and probably a lot of what you've seen and can relate to when you're dealing with people that have this kind of condition. So as everybody knows, when we talk about psychiatric issues, we're going to quote it from the Mayo Clinic. I'm sorry, I get a little excited. So the Mayo Clinic, so if you don't like what it says, go sue them. So schizophrenia, it's a very serious mental health condition. It affects how people think, feel, and behave. It could result in a mix of like hallucinations, like deliriums, and like a disorganized kind of thinking and behavior. It's very confusing. And we can say it's confusing from the outside looking in, but to the person on the inside, it's even more confusing. And we'll get into that as we go. So they tend to have hallucinations that involve seeing things or hearing voices that other people can't see or hear. The delusions involve like where they have like a real strong belief about things that aren't true. Like, for instance, like the clouds, circle, they move in circles instead of move from, whichever way the front's going, simple things that they see differently that other people don't because their brain's not, functioning like everyone else's. Or they could be thinking like, that people are talking about them and really they're not. It's just they just look over in a certain direction and they just feel like somebody's like talking about them when in fact those people are talking about shoes. So it's a difficult condition. It's a serious condition. Generally, people with schizophrenia they lose touch with reality. We see that a lot with people with schizophrenia. They don't live in the real world. And it makes like their daily living hard because people don't know how to communicate with people that don't live in the real world because you don't really know what they're going to come at you with. Is it going to be, nice and calm and peaceful? Is it going to be a little intense? Is it going to be enraged? What are they coming at you with? And is it something that can you even talk them down from it? So that's a very difficult situation. The one person that I know of to be schizophrenic, but to me, it's questionable. But generally, they think that there's something that they're not. Like this specific person, they were a mall security guard, but they turned themselves mentally into a cop, which could be a dangerous situation because if you're not an actual police officer and you don't have firearms or firearms training and you're running around thinking that you're a police officer when in fact you're just a mall security officer, could put you in some very, very tough situations where you could potentially be killed. So, that's a situation where, you that could cause problems for somebody with schizophrenia, or they could go try arresting people that they have no authority of arresting. So, those are, certain types of things. And then that certain type of person, or that certain sane person, went and started working in a hospital as a nutritionalist. And now they're a doctor in their mind. So you have these scenarios where they're given these little tiny little pieces of success, and then in their mind they're something much bigger than what they are. Now, you can't have a nutritionalist thinking they're a doctor, obviously, in a hospital especially. That could pose a very, very dangerous situation for patients. So we have to understand that their minds, when it comes to, like these delirious thoughts and the hallucinations, the things that they hear and see are something that they're struggling with, trying to figure out is this real or not. So people who have a schizophrenic diagnosis, there's Shauna. Hello, Shauna. You fact checked me already? A nutritionist. I said nutritionalist. She's right. It's a nutritionist. But so these people, this is a lifelong treatment. If you're diagnosed with schizophrenia, you're going to need treatment for the rest of your life. This is something that no cure. Just like when we were talking a few weeks ago about narcissism. I'll tell Kai I said hi too. And Zoe. Tell Zoe I said hi. So when you have these situations and people, like I said, a couple weeks ago, narcissism there's no cure. There's nothing that you can do to fix it. And that's the same as when we're looking at, schizophrenia. The difference between narcissism, other than the behaviors that are exerted, because they're very different, but the difference treatment-wise is narcissism has no real treatment. There's no isolated treatment for narcissism, whereas schizophrenia does. There's a number of ways to treat schizophrenia, and that's a good sign, because if you feel like you're starting to lose track of what reality is, that's a sign, and you should go see your psychiatrist or mental health counselor or whoever it is that you go talk to, and start to take the steps to see where, is this something that you have? Because the earlier the detection, the less damage you're going to do to yourself later, because you can do a lot of damage in this world when you have an undiagnosed schizophrenic situation. So most people, though, that are schizophrenic, they don't realize they're schizophrenic. They don't realize that they have a mental health issue, because they believe truly in their mind that these things are happening and that they're real. So when you're not capable of, like how we talk about in the previous episodes about, one of my personal favorite, treatment methods is to look at myself in the mirror every day. Well, if you have schizophrenia and you're looking at yourself in the mirror every day, you're going to see something totally different than what you actually are. So that method is generally not going to work for you if you don't realize you have this condition. So it poses a real tricky situation. And I keep saying tricky situation, but it is a tricky situation. I shouldn't laugh about it, but it's difficult. The self honesty to self-identify is going to be hard to do. You're not going to be able to do it. I'm not going to say not, but it's going to be very difficult to do. And so, there is a very high probability that if you have an undiagnosed, case of schizophrenia, that you're probably already experiencing some sense of psychosis. And we've talked about that in, the depression, the clinical depression episode. But psychosis is a serious situation. When you get to that point, it's almost the point of no return. And I'm not saying it can't be that you can't come back to normal. It's just going to be more difficult to do. Because if you're experiencing psychosis, you're damaging things, you're damaging relationships, you're damaging yourself. So it just depends on how far into the psychosis that you've gone before someone has intervened or whatnot. And most of the time, that's what it takes. Somebody's going to have to intervene. If somebody's experiencing schizophrenic tendencies, somebody from the outside looking in is generally going to have to intervene, because most, like we said, those people, they do not see that they have a mental health issue. They see an alternate reality. So let's go through and talk about some symptoms of schizophrenia so we have a better idea of what we're looking at. And I know some of you may be looking at this in your children or your young adults. But we do know that generally children, they will not diagnose young children with schizophrenia. So it's one of those things where, and we'll get into the symptoms, and then it'll make better sense as to why they don't do that. So delusions, obviously, we've already talked about the delusions. When people believe in things that aren't real or true, it's very common amongst schizophrenia. Number 2 is hallucinations. They involve seeing or hearing things that other people don't. The hallucinations can occur with any of your senses, but it's generally through hearing. That's the most common. You hear voices. So then there's disorganized speech and thinking. And disorganized speech causes disorganized thinking. It can be hard for people with schizophrenia to talk with other people because they have this whole other movie going on in their head, but they're walking around in reality, but their mind is somewhere else. And so if you're asking somebody with schizophrenia a question, they're going to answer probably what's inside this movie that's playing on in their head. So it's going to be very hard for them to communicate with other people because they have to figure out quickly which one of these scenarios is real and which one is not real. And so it makes it difficult. Sometimes they choose wrong. Sometimes they'll intertwine the two worlds together and they'll make up a word, which they call that word salad. I wonder where we heard that word before. Kamala Harris. Okay, this isn't a political show. I forgot. So hallucinations, they come with the senses. They hear things. You've got the disorganized speech and thinking. With that, the questions, they may not answer them fully. So if you're hearing like partial answers to questions that you're asking, that could be a sign that there's maybe some schizophrenia starting to build. If they answer the question and it's not related to the question, that's generally a sign. Like I said, could put unrelated words together, and they call that word salad. It's just you'll know when you hear it. Then the next one is extremely disorganized or unusual motor behavior. This may show in several ways, from childlike silliness to being agitated for no reason. So this almost has a bipolar look to it. The behavior isn't focused on a goal, so it's hard to do tasks. So there's no reward that people with schizophrenia are seeking. There's nothing to strive for. So that could cause problems. There's no motivation. They may move in ways that are not typical or not appropriate to the social setting. The spectrum. Hey, it's we got Sergeant here and we got Robin. So the spectrum is huge, and there's so much stuff that can go on with schizophrenia. And that's why it's something that we really don't want to play with when we start seeing some of these symptoms pop up with people. Yeah, you walked in at the right time then, Sarge. Yeah, I forgot. This isn't the political show. This is the mental health show. So I had to stop myself. And Shauna's in the chats. So if you're seeing somebody in like a group of people and you're seeing this flow of how people are kind of intermingling with each other, and then you see that one person that's just not flowing with everybody else. They're kind of back and reserved, and maybe they look agitated, or they're struggling in this crowd. That could be a sign where we're seeing like some schizophrenic situations, because in their mind they may be somewhere else and they're panicking. So that's another symptom that we need to look out for. And let me find my cursor here. The last one for the symptoms is negative symptoms. So people with schizophrenia may not be able to function in the way they could before their illness started. And we'll get into the causes of schizophrenia here in a minute, because that's going to kind of better explain this here in a few. So for an example, they may not bathe or make eye contact or show emotions. They could speak in like monotone voices, and they won't feel like the pressure of things, being under pressure. They may lose interest in everyday activities, which is very similar to what we learned in the clinical depression episode. And they could socially withdraw and have a hard time planning ahead. I could see where they would have a very difficult time planning ahead, simply because there's their inability to stay in reality for a long period of time, unless they're medicated. That's probably what they're going to struggle with. So statistic wise, so usually the diagnosis of schizophrenia happens between the late teen years and 30. So that's when you start really seeing those signs. Not saying it can't happen before and it can't happen after, but generally when we're looking at averages, that's our range right there, 18 to 30-ish. So pay attention. Women's a little bit different. Focus is very hard. They're going to have a tough time focusing because they don't know where their focus is supposed to be. But women, they can go from 20 to 30. So that's when their schizophrenia can kick in. So, Shauna's in that age range, so she's probably a schizophrenic. Just kidding. Shauna's not schizophrenic. She's not a schizophrenic. With children, like I said a little bit ago, so children, generally they don't diagnose children with schizophrenia. That's a hard label to put on a child, especially if you're wrong about it as a mental health professional. And because schizophrenia has a lot, as we learned about some of the symptoms and some of the issues, these could match with other, symptoms, especially at a young age when they're, where their frontal lobe of their brain is still manifesting imagination. So it's easy to kind of see that and say, well, is this their frontal lobe developing, or is this a hallucination from a mental illness? So it's best to just not diagnose these kids, because this could just be natural frontal lobe development rather than a mental health issue starting. You want your kids to develop that mental health, or that frontal lobe. It's healthy for them to use their imagination, because in today's world, if you're not exercising that frontal lobe, you're not going to be able to problem solve and see things, in a problem solving way. Because generally, what happens is most kids they get so programmed on reactive thinking because they're playing video games all day, where they're reacting. And then they neglect their frontal lobe. So then they lose their ability to problem solve, and they spend the rest of their life reacting to things. So there is actually a mental tactic to that. You want to have a good balance there. It's okay for them to play video games, but you want to cut their screen time so they can continue to develop their frontal lobe. So there you go. There's my nerding out for the second. Let's talk about the symptoms in teenagers, because that's when that's the bottom when they start to look at, is schizophrenia present or is it not? We can start to see that in teenagers, but it is confusing, and we'll talk about that. So teenagers, they can be withdrawing from friends and family. That's one symptom. Number 2, not doing well in school. Number 3, having trouble sleeping. Number 4, feeling irritable or depressed. Number 5, lacking motivation. So this is basically the same, almost same exact symptoms as clinical depression. So I think when you start to see these show up among, when you're if you have a teenager and they're starting to experience these things and they're starting to detach from everyone, they don't have any motivation, they don't want to do anything. I think that's when you just need to go ahead on the safe side, schedule an appointment with the counselor, and get in there and find out where is your mind at and what can we do with it. Yes, Asperger's is also another one, which if I remember correctly. So Asperger's, when I was in school, when I was in college, Asperger's was still a thing, but I think they took it off the spectrum altogether now. I think it's just basically they combined it with another form of autism, and now Asperger's disappeared. But there is a difference. Asperger's is slightly different than autism, so I think they should respect the differences of Asperger's. My youngest son has Asperger's, so, or at least he had. I don't know what his diagnosis changed to, but when we took him, he was diagnosed with Asperger's. So I'm very familiar with the Asperger's syndrome. So then when we look at the symptoms in teenagers, again, they're very common. This could just be teenagers being teenagers. It could be depression, or it could be potentially worse, where we're seeing schizophrenia start to kick in. If we also have to remember that when teenagers start feeling those types of emotions and they start feeling that type of way, that we have to pay attention, because there's a higher probability that they could be having suicidal thoughts. I know I was a teenager once. I know I've been there. And so it's just, we have to pay attention to how they're thinking, how they're behaving, and talk to our teenagers and find out, how, are you feeling any type of way? Let's just go talk to some counselors and be honest and dig these things out. Obviously, you want to contact the suicide hotlines if you're feeling any type of way, if you're starting to hear things, see things that aren't there, feel negative thoughts, and you're starting to hear things. So we need to really pay attention to our teenage kids, that they're very susceptible to reacting irrationally. So treatment-wise, so the first thing they're going to want you to do is you go in and get a physical exam, make sure you're just naturally healthy, or if you have health issues that could be contributing to the way that you're thinking, they're going to want to know that. So they're going to do some tests where you could get, I don't want to say you're going to get it every time. I don't want to scare you away from a massive medical bill, but they could offer to have you get an MRI or a CT scan. It does happen, especially a CT scan. Because there could be, sometimes it could be a crazy thing, like there's a tumor that's blocking receptors that's making you think that way. So they're just going to go ahead and look at everything just to make sure that there's nothing outside of mental health that's causing these problems. They used to rule out, they use this basically to rule out other conditions. Like I said, like some of the symptoms are similar to clinical depression. So they have to go through these different tests to say, okay, that's not clinical depression, or that's not, bipolar disorder. So they can help narrow down what exactly is the issue, because the treatments are very, very much different. And you want to make sure that you're getting treated for the right thing in the right way. So we're going to go over a few medications. I'm not going to spend a bunch of time on medications because there's so many. There's so many antipsychotic meds for this condition. So I only took note of the major ones. So the antipsychotic medicines, They're used to control the symptoms mainly by affecting brain receptors for different neurotransmitters or chemical messages. So they're basically, Shauna, every time. I'm going to drug test you tomorrow. But so what they've learned is that if they can, bypass certain transmitters, that it can kind of deaden the anti-reality thoughts that they have, and it'll help them see into regular reality. So that's so that is one thing that's going to help them, is if they kind of block that irrational part of the receptors and just go right to reality with it. And so that's good job, Shauna. Look what you did. A lot of that is with the dopamine and the serotonin receptors. So they're going to have to manipulate those depending upon if you're going through a natural high or a natural low. So they're either going to increase one, decrease one. So it just depends on how you're reacting to things and where you're feeling physically. You know what? I'm not even going to argue with that, Rob. I'm not going to argue with it. It's too late, Shauna. I'm already hip to you. So yeah, Rob brought up a good point that, medical marijuana would be probably a good avenue. I'm not going to sit here and say that that's the prescription, because I am no doctor. But if it was me and I didn't want to spend a bunch of money on it, I would self-medicate with weed to deal with these things, and hopefully, and then just play around with it and see if it works. You see how Shauna's got in there, and she utilized Veterans Day to peddle her marijuana usage. See, Shauna, I do this. All the manipulating. Back to what I was talking about. So the medication wise, so there's several medications that they prescribe for schizophrenia: Abilify, Safaris, Rexulti, Vraylar, Clozaril, Risperdal, Zyprexa. Risperdal is very common. It's one of the ones that a lot of psychiatrists will prescribe. So is Abilify. Those are the two main ones. Zyprexa is getting more popular. Some of these meds can be given by shot every 2 to 4 weeks. So if you're a person that doesn't like to take pills, they can inject it in you every 2 to 4 weeks. I think, having that kind of dose in you that'll level you out consistently for 2 to 4 weeks would be a good thing. And I just think that would be, if you don't like taking pills, get the shots. They're going to be just as effective or more. So psychosocial interventions. So we're going to talk about the therapy aspects of it. So you're going to want to go through individual therapy. You have to go through individual therapy. That's going to be the biggest one for you, to sit down and really talk these thoughts out. If you're having these hallucinations, you want to verbalize them. If you're having delirium, you want to verbalize that. It's going to help. For one, it's going to help your counselor understand the situation better. But it's also going to help you speak out loud what your issues are. And you generally, when you verbalize something, you mentally take note of your own verbalization. It's just kind of something that you do. I talk to myself all the time just so I retain things that I'm trying to remember. So social skills training, which is basically working around people. That's a very difficult thing for people with schizophrenia that are not being treated. They struggle with, being around people and working with people. I should have done a drug episode. You guys are just ignoring me and talking about drugs. Just kidding. But social skills training is important. Family therapy. I recommend family therapy is going to be important here. Whether you do it all as one family, or like if you have a child that has schizophrenic tendencies, you go to therapy and learn how to deal with the child. Work on what you have to do as a parent, a provider, a caregiver to help ease the pain, ease the mental anguish of the person with schizophrenia. It's literally a battle all day in their brain that they go through, in and out of reality, in and out of reality. Could you imagine? It is genetic, Shauna. It is very genetic, and we're going to get into that. So hospitalization is common for people with schizophrenia. A lot of times they have psychiatric breaks where that psychosis kicks in, and sometimes the only thing that is going to help is to go under a 72-hour observation, which it sounds horrible, but I would rather someone go through that than harm other people or harm themselves. So sometimes it's just a necessary evil that, just take 3 days off, go check in, or have somebody check you in and get this crisis worked out. That psychosis isn't going to work for regular society. So just remember that. Swallow your pride. I know it's not the most glorious thing to go, get psychiatric treatment at a hospital, especially. But I recommend that you do it if you are starting to feel a certain type of way. And if you're a loved one that's starting to see this aggressive behavior, go ahead and get it done. I'm not going to sit here and tell you every time somebody gets upset, you got to drag them to a psychiatric hospital. But you can tell when someone is struggling mentally. And we have to stop ignoring those signs. We ignore them all the time. And I think that's why we have a lot of the school shootings and the mass shootings in this country, because too many people are ignoring the signs. So that's one of the reasons why I do this show, because I want people to be aware. Mental health issues. I mean, I'm not going to sit here and poke fun of people, but I'm seeing mental health issues all over the place on the internet right now. And these people don't even realize they have them. So you get on TikTok, every other video, somebody having a mental health breakdown. Yeah, and you're right, Sarge. But you can self-check in, and it's if you have insurance, they're going to let you do it. But if you don't have insurance, they're probably still going to let you do it, but you're going to have a really big bill. It probably depends on the state you're in, because I think a lot of places are not going to. There's not really a lot of like financial help when it comes to that. I know a lot of places do a sliding fee scale, but for an actual psychiatric, a 72-hour stay. I mean, I would throw somebody in there. I've taken people to the psychiatric ward before. It's not a fun thing. Usually it's because they're ultra aggressive and they're harmful to themselves and the people around them, and you can tell they're having a psychiatric issue. Yeah, they can't make them stay for sure. You can check out anytime you want. But if you're able to get into that right state of mind, just stay there for the duration and just get it worked out. Just even if it's just 2 days, take the 48 hours, stay there and get it worked out. It's better than to fake it to make it. You see so many people fake it to make it, they get out and then nothing gets solved. Then they, go run their kids in the car off a cliff and all kinds of crazy shit happens. So we want to prevent those types of things. So when they go into the hospital, they're going to make the hospital is going to make sure you're eating right. They're going to make sure you're getting enough sleep and that you're bathing. This is things that you neglect if you're schizophrenic, because you don't realize that you have to do those things, or you may have thought that you already did it, or you just didn't. You don't know what day it is. It just depends on where your mind's at that day. But they're going to make sure that you're getting those regular things. Your body needs regularity. So if you're in another world and your body needs its regularity, the psychiatric hospital is going to make sure you get it. So here's another one: electroconvulsive therapy. So this is an extreme, and I don't want to say it's extreme. It's effective. I've seen this done. So now, if the proper meds, Rob, if the proper meds do not work, that's when we're going to go into the electroconvulsive therapy. So what they're going to do is they're going to give you a general anesthesia. They're going to put you under, and then they're going to put electrical currents through your body. And it's going to give you like a therapeutic, like seizure, like a vibration. It's going to get this vibration going. And they generally will do it for like 1 to 2 minutes, depending upon your body weight and all that. So that's going to help kind of slow things down, calm your whole body and your mind. That vibration matters. We all run off of vibration. So yeah, it's going to find the short. You're exactly right. That's actually a better way to say it. It's going to find the short, and it's going to kind of fuse it back together temporarily. It's not a foolproof method, but it will give you temporary relief, hopefully for a few weeks. So I wasn't typing fast enough today for my outline, so I had just saved a couple things that I wanted to talk about. So the cause of schizophrenia, and we were getting ready to talk about that. What causes schizophrenia? Nobody knows. They don't know. I have a theory, and I'm going to share that theory with you. They think that it could be part of genetic and environmental factors. So when it comes to genetics, generally, you can see it. Schizophrenia generally runs in family bloodlines. I've seen it over and over and over again. To me, that's an obvious one that it is genetic. Like I think Shauna had mentioned that it is genetic. So you have environmental issues, and this is kind of what we talked about a few weeks ago with the narcissism. So there's no known cause for narcissism, just like with schizophrenia. And so genetics played a part. The environmental factors play a part too. So I'm going to kind of combine all these together here in a second. But you tend to, whatever your environment is, that's going to affect how the makeup of your brain goes. So if you're in a confusing situation, or if you're in an abusive situation, or you're watching abuse on a regular basis, or you're watching these certain things happen that have adverse effects on you as a human being, to the point to where your brain has to change its receptor pattern, that could cause those things. Brain chemistry. So you could have a lack of dopamine or an overload of serotonin, one of the two, and that could cause it to kind of happen. Substance abuse can also cause it to happen. So yeah, all your conversation over here could cause you to be schizophrenic. Like certain neurotransmitters, they can either be not active enough, or they can be too active. So that's part of the brain chemistry part of it. But the Mayo Clinic says heavy use of cannabis, alcohol, tobacco, cocaine, amphetamines, methamphetamines, methadone, MDMA, LSD, psilocybins, and ketamine can trigger psychotic episodes. There you go. No, nobody has a rebuttal for that. But that's what the Mayo Clinic says. Some of those make sense, some of them don't. To me, anyway. So you also have brain structure. People with schizophrenia, they could have a different size of in certain brain areas. There could be because your brain, when it struggles, it contracts like a muscle. Like when you're lifting weights, your muscle contracts. Your brain does the same thing. When it's overworked, it'll start to shrink and it contracts. So you may have a certain part of the brain that's just contracting a little bit all the time, and that could be causing. They think that could be causing some of the issues with the schizophrenia. I don't think they really know 100% for sure, but that is the theory that they have. Yeah, you're right. You're right, Rob. I'm a firm believer that if it grows in the ground, it should be good. Anything that's made in the lab, hell no. It's not possible to prevent schizophrenia. So my theory is, and I've studied this for a long time, and I've talked with other doctors about this in the past, and so what I think is that your brain doesn't have a super physical defense mechanism. Everything is a mental, an electrical response to defending itself, where it'll shut things off. You'll freeze, or you'll fight, or you'll flight. So I think when you go through something traumatic, and it opens up this part of your brain that says the brain needs a defense mechanism. So I don't know if any of you have seen the movie The New Mutants, where I can't remember what the girl's name is, but she plays the Russian in there, and she can jump into an alternate reality where she's like this super badass. But then she figured out how to bring that badass into reality, and that's kind of how the brain's working when it comes to schizophrenia. The brain knows that it needs a defense mechanism because of this factor, this environmental factor, this environmental factor. So what it does is it develops an alternate reality in the mind to escape the things that hurt it. And that's what I think. I think it's the brain creates this mechanism of defense to protect itself from things that other parts of the brain are not capable of handling, or it's not processing it fast enough. So that's my theory on that. And that other people have that same type of theory, that that the brain can protect itself by putting it somewhere else that's out of the threat. Because at the end of the day, when we look at fear, and we look at happiness, and we look at sadness, and we look at rage, all of those things are here. They're not like, happiness can't hurt you. Rage can't hurt you. The feeling of rage can't hurt you. It's all a transmitter emotional response. And so one thing that helps me with things is when I start to feel emotions, I have to remember that as fast as that emotion entered my thought process and entered my neurotransmitters and starts moving around in my brain and trying to look for places for it to react, I can make that thought go away the same way it came in. It was a poof to come in, and it can be a poof to go out. So that may be like a sociopathic method or ideology, but it works for me. I can keep myself from danger by doing that. Like, is this really hurting me, or is it just a thought? It's an emotional response. I can make that go away. I will find another emotional response to replace it. So that may make me sound like a complete moron, but I spend a lot of time, dealing with my own demons. So I've spent my whole life trying to figure out how to cope with them, and studied things, and went to college for these things. So I'm not a genius, but every once in a while I come up with a decent idea. But that's going to be our episode on schizophrenia for the day. I'm glad you guys tuned in. Thanks for jumping in my comments today. You guys are always fun, and you're always welcome to come back. Rob, hopefully it's not snowing up in Canada for you yet. Sarge, thanks for coming back, man. We missed you. Happy Veterans Day, buddy. And thank you for everything you've done. Shauna, thanks for jumping in the comments today. You're probably more fun in there than you are on my show. Just saying. Just kidding. Don't hit me tomorrow. I have to go to HR. But that's our show for the day. Thanks for tuning in. Hey, pay attention to all your people, okay? If you start seeing signs, let's try to be proactive on things. At least talk to them. Say, hey man, how you doing? How you feeling? Can you want to talk? At least give them something to listen to. Do our part. Okay. There we go. Keep working hard, Sarge. I see what you're saying.